Welcome to the PharmOutcomes training video for the Digital Minor Illness Referral Service, DMIRS. Following the success of the Community Pharmacy Referral Service in the northeast of England, the Digital Minor Illness Referral Service is being rolled out across England in 3 pilot sites. The Midlands and the South West are being supported by PharmOutcomes, and this video provides an overview of how the service works. DMIRS provides an opportunity for low acuity patients that present at NHS 111 to be referred to a community pharmacy following telephone triage. The referral takes place directly from the NHS 111 system, Pathways, and using ITK mapping, selected information can be drawn from Pathways and passed to a patient's nominated pharmacy. This video demonstrates the process and shows how pharmacies receive referral information. When a patient or their advocate calls the NHS 111 team, they will initially provide demographic information. The call handler will then go through a series of triage questions to determine how serious the condition is that the patient has called about and who to refer the patient to following triage. The call handler will now establish who it is they are talking to, the patient or a representative. The triage process will now begin with a view to ruling out immediate threats to life. Answers recorded in Pathways will direct the call handler down a specific pathway until an outcome is established, and this will include how serious the condition is. Questions are initially asked to check if an ambulance should be dispatched while the call handler proceeds through the pathway. Questions asked at this initial stage include questions about: is the patient unconscious, fitting or choking? Is the patient bleeding? Clarification of main problem covering issues such as: is this a recurring problem, an injury, symptoms, is it a vulnerable person, suicide risk, and so on. Is the patient having difficulty breathing? Once these questions have been asked and the need for ambulance attendance has been eliminated, further triage questions continue to investigate the need for serious medical intervention or assistance. These cover things like possible allergic reactions, diabetic hypos, etc. Is the patient floppy? Level of consciousness. Does the patient have a temperature? The call handler eventually gets to a screen where an initial diagnosis is recorded, in other words the main problem has been identified, and a suitable onward provider can be identified for referral. In this example, the caller has reported symptoms of cold or flu. There now follows a series of triage questions about how serious the cold or flu might be. For example, is the patient so ill that they are unable to carry out usual activities? Is the patient crying non-stop? Is the patient breathless or wheezy? Is the patient confused? Are there signs of fever? Are there signs of eye infection? This screen describes the main presenting symptoms, for example, cough, runny nose and sneezing. This question eliminates risks of other conditions such as malaria by asking, has the patient been away? This screen investigates any comorbidities that might exacerbate the problem. These questions further investigate fever if this has been reported. For example, how long has the patient had the fever? Is it worsening? These questions investigate if patients have been previously instructed by a doctor to take specific remedies for their condition. For example, rescue treatment with COPD patients. Has the patient deteriorated in the last 24 hours? This screen records the consultation outcome. Once the problem has been fully explored, Pathways uses the NHS Directory of Services, or DOS, to match symptom groups to potential healthcare provider types. The trained NHS 111 call operator has additional choices at this stage to record a different disposition. The outcome here is that a referral to community pharmacy is appropriate, disposition 28. This screen allows provider selection. Providers will be displayed by postcode proximity, in other words, the nearest to the patient's current position, most probably home postcode. The referral can now be sent to the community pharmacy selected. Referrals received from the DMIRS service will appear on your PharmOutcomes services page at the top of the screen in the Outstanding Referrals section. You will also receive a reminder email to your PharmOutcomes management email address to alert you to the fact that a referral has been received. If you have a Farm Alarm installed, it will flash to alert you of a new referral. Farm Alarm can be rented for £1 per week. In some areas, funding has been secured for their acquisition. Please check local arrangements. Click on the referral to access the pharmacy follow-up stage. Before you access the service for the first time, you will need to complete the enrolment criteria. Type your name into the practitioner name field and select the match that appears below. The patient details as recorded on the pathway system will appear here. A summary of the triage carried out by the NHS 111 call operator appears here. If it is necessary to reject the referral, for example because the patient is not contactable after 3 attempts, record the reason here and click Reject Referral. In this instance, a message will be sent back to the emergency services when the referral is rejected. To complete the follow-up stage, click Complete Now. Consent must be given for service and information sharing. Consent is usually from the patient, but this may be the advocate if one presents on behalf of or with the patient. If you are obtaining consent from a young person under the age of 16, please consider Gillick competency. Select the presenting condition from the drop-down list. Note any relevant medical history here. A clinical summary and relevant notes should be recorded in this box. A link to the nice clinical knowledge summaries is available on the right-hand side of the screen. The clinical knowledge summaries contain practical guidance and can support your clinical decision-making. If you have identified any red flag symptoms or escalation is required for another reason, clicking Yes here will reveal information on your options for clinical support. Please detail any action taken here. If no red flag symptoms are identified, click No here. Tick here to confirm that you have given the patient the advice that appears. Record the name of the GP practice that the patient reports they are registered at. Start to type the name of the GP practice and select the correct surgery below. If the GP practice is able to receive notifications by email, they will automatically receive the post-event notification when you save this form. Type the name of the patient's doctor here. If the patient is unsure of their GP, you can enter Not Known. Select the appropriate consultation outcome. If you select Escalation Pharmacy called 999 as the consultation outcome, a referral will be sent back to the service manager by email. If the appropriate outcome includes supply of a medicine, please read the notes on medicine supply that will appear below. If a medicine is to be purchased or supplied via a local minor ailment scheme, please record details of that medicine here. Please note that the quantity needs to be entered in the number of unit doses, not the number of packs. Tick here if you have given advice to the patient aligned with the NICE clinical knowledge summaries. There is again a link to the clinical knowledge summaries on the right-hand side of this page. Any other advice or support provided should be recorded here. Finally, if you would like to report an incident or send a message to the DMIRS commissioners, please enter the information in this box. The information you enter here will be sent to the commissioner by email when you save this form. Payments for provision of this service are managed automatically through PharmOutcomes.